it's actually, when you talk about regulation and inspectors, I'm reminded of the story I had done a long time ago. So in research किया था इस पे labor regulations,
Right.
in factories when say let's say kids are being employed, or the regulations of the factory are bad, where there is
Correct.
no safety equipment or etc. These
Correct.
inspectors come in, and I'm
Yeah.
specifically talking about some factories in Rajasthan which we were looking at,
Sure.
textile,
Sure.
and
Yeah.
they used to come in, and the foremen etc. would just give them like bribes, let them go, and that's what they did. Like on a weekly basis they came to collect
Correct.
bribes and went away.
Right.
uh, do
Hmm.
Exactly.
we see something like that happening in the drug regulation scene also? Because that's scary.
So, Prashant, you want to talk about some of the incidents where some of the drug inspectors were convicted and tried, right?
I mean, see, honestly, we don't know what these drug inspectors do because their inspection
Okay.
reports are not
That's
public,
all. That's a
right?
great way
Okay.
to
So, like,
start.
Right.
no, so when the US FDA goes and inspects a pharmaceutical plant, that's the American drug regulator,
Yeah.
they publish an inspection report on their website, which anybody can access. So even if they inspect plants in India, you can go see what exactly they found in that inspection. But in India, we don't know what exactly is happening because the inspection reports are never public. But moreover, on the point of corruption, there is no shortage of drug inspectors being arrested in India on
Hmm.
corruption charges. You just have to do a simple Google search, and it's alarming the number of drug inspectors who are arrested on charges of corruption.
Are these drug inspectors actually qualified to be drug inspectors, or they're just random people who just get these jobs and they don't know and that's why they don't do it? Or is it like a quick money grab scheme for them?
No, I mean, they are qualified. The government has regulations in place on what your minimum qualifications should be. And in some states, they do work well. So we've seen
Okay.
in Karnataka, for example, the only state where we got access to some of these inspection reports. I don't know. They surprised us under the RTI Act when they gave it to us,
Hmm.
and it was very clear. Like those drug inspectors knew what they were doing.
What they were
They
doing.
Hmm.
they produced a list of some 75 violations over 4 pages, and used that to
Hmm.
justify shutting a company down.
Why don't we make
So
them
it
the
can
head?
work.
It
Yeah.
can work.
Can
But
work. So it depends on
yeah.
the state government, and whether they put enough pressure on their drug inspectors to do an honest job.
Okay, here's the question then. So let's say Karnataka, if we are looking at Karnataka, um, so I am a drug inspector going into like a, let's say, a manufacturing plant for a big pharmaceutical company. Now, what will I do? Like I'll pick out like samples from each medicine, take it to my own lab, test it, see if it's like according to regulations, produce a report if there are violations, and until I produce that report, the drug will not go out in the market. I mean,
Ideally,
I'm just imagining
hopefully.
that way, right? Is that how it happens?
Dinesh, why don't you take it? You're the expert
Yeah.
on
So,
GLPs.
so, so I think, Meghnad, this is a really important point which we don't pay attention to, right? So,
Hmm.
in the rest of the world, right, quality is measured by design. So, let's say that in order to make a tablet, there are 5 things
Hmm.
you have to do, right?
Okay.
You have to get the medicine, you have to mix it with whatever you mix it, then you have to make it in the form of a pill, then you put it
Hmm.
in a packaging, then you put the label on it. So let's assume those are 5 things, right?
Right.
In the rest of the world, the law says that with each of these steps, there is a quality measurement, right?
Okay.
That's how the rest of the world works. In
Hmm.
our country, the law is written in such a way that we measure quality by what is in the market. So we don't
What does
Wait,
that
out.
mean?
have to
It's
go.
already out in the market.
Oh, how's
Correct.
it doing in the market?
Correct. So
Oh,
what
so we are the
happens is
guinea
that,
pigs. We are the guinea pigs,
well,
basically.
well, the way
That
it
is
works is that
insane.
what happens, the law says this the following, right? The law says that the way we measure quality is that we tell the drug inspector to go to the pharmacy and pick up samples.
Oh, that makes
Okay.
no sense.
Wait. The drug is already
Well,
out in the market, and then that's when
correct.
the drug inspectors go, and then they buy it themselves, and then they
That's
test it.
right. That's right. So let me explain to you how the process works. Okay. So
Okay.
the drug inspector goes to the pharmacy. He buys the tablet sample, whatever the drug is, injectable, whatever,
Right.
right? And the law says that you have to make 3 copies of it. So you buy 3 strips of it. And you have to
Okay.
pack it in a certain way, right? Because then you give one of these things to the shop owner to say, look, this is the drug, you have to keep it. I've taken the 2 other ones, right? So then they send the packaged one, and there's like several steps in there to ensure that there's no tampering and this, that, and the other, to a state drug lab, right? The state
Okay.
drug lab actually then tests that thing. And
Hmm.
then once it tests it, and it finds out whether it is of a standard quality or not. That is how we think about quality. Now, it doesn't. Before you go, let me just tell you something interesting. So one of the things for the book, what we did was we actually wanted to see how many of those samples actually fail, right?
Yeah.
So in India, among all our states, only 3 states tell us there's a public database where anything fails, they put it up there. So
Mm-hmm.
Gujarat, Maharashtra, and Kerala, right?
Okay.
These are the only 3 states in the union that actually publish data on failure of drugs. What we found out, when we were doing a research for a book, is in the last decade, 7,500 drugs that were tested by these states that were already in the market
Oh.
and were being consumed by people failed quality standards. Now, when was the last time
7,500.
100. That's a big number.
7,500. Now remember, each of those is a representative of a batch of 100,000. 1 lakh tablets.
That's
2
what I
lakh
was. Yeah. Yeah. Right.
right?
Right.
So multiply 7,500 times 100,000, at least एक batch के लिए.
Some of them are a
And this
million.
is on
Some
the
batches are a million.
Yeah.
Oh
So
my God,
imagine
that's scary.
these are all on the market. Now, I'll conclude my answer with just one last point, right?
Hmm.
Yesterday, the Bureau of Investigative Journalism UK published a report about a drug called aspergillase. Okay, this is a drug that is used in childhood cancer. Okay, pediatric oncology.
Hmm. Hmm.
There is a doctor from the Tata Institute of Cancer in Kolkata on record saying that among the 5 different manufacturers of this drug in India, none of them work.
None of them work.
None of them work.
Okay.
Okay.
And it's still out there?
It is still out there. People are buying it. And it's expensive drug. It is for childhood cancer. Look it up. It's Bureau of Investigative Journalism.
Oh my God, that's scary.
And
I
also,
regret doing this, Dinesh. I regret doing this episode. Like immediately. I'm like, what rabbit hole are we going into? Seriously? Okay.
why
No,
drugs
so
are better?
I like this. I read again, as I said, I read a few pages of this book. So धीरे धीरे garden
Enough,
path चालू हो गया था इसका. Like I mean, like they were taking me down that road.